Hello, my name is Laura Cartwright, and the social policy that I am going to create a media advocacy plan for is Medicare for All. It's also known as universal health care. As mentioned in the article, social media and just media and technology in general has definitely grown and expanded in the past 10 years. It is making it easier to reach out to targeted populations and also to obtain information. So, what I would do is for my advocacy plan is I would start by creating a Facebook page dedicated to universal health care and people sharing their stories regarding their experiences with difficulties that they may have had trying to find accessible health care. This would also be used to share these stories on a larger platform by, as we all know, sharing a video from a page and having it reach a larger demographic. It could also provide information to individuals who may not really understand what universal health care is. This page could also provide resources to individuals who may want to contribute and find nonprofit organizations that maybe they could volunteer for. So another way that I would advocate is if there is a nonprofit organization holding an event, maybe helping them reach volunteers by sharing a page and saying, hey, this event's going on this weekend. We need volunteers, maybe to gather some signatures or to gather some petitions, and reach out to people that way. Create an event, have RSVPs made, and really just kind of continue to share that and grow. I think another thing that could be done are fundraisers on a social media page. As we've seen, even with the birthdays now, you have the option to share a charitable donation to your friends on social media to have them donate money to contribute to your cause. So by providing these stories and these personal stories of individuals who are having difficulty finding accessible health care, we can potentially share those, have a personal impact with the community, reach larger communities, not just a small demographic area, but expand the area, because as we know, even with social media, you can pick the radius that you want to target your audience, and really expand to get the message out a bit more. This will also help identify the stakeholders and really be able to identify what populations are going to be affected, and provide updated information to those individuals who may not have accessibility to them. So as we all know, policies are continually changing. There's always updates in what the policy actually consists of or the status of it. And by having a social media page, we can share that information with other individuals and continue to educate the communities and individuals and have them, again, in turn, share that information with others and just become more knowledgeable about it and get more individuals actively involved with volunteering, fundraising, and even contributing with their own social media support.